Okay, hello, my name is Dr. Cindy Morse, and I am the manager here at CCBC Essex in the nursing lab. And I just want to welcome you to our wonderful simulation suite. I'll start you with a quick tour. So this room here is an IPE room. It's actually made into a small apartment so our students can come in and do simulations in a home setting. And IPE stands for interprofessional education, so at times other departments will come use this area. So EMTs, other departments in the School of Health will come use this also. And if you follow me down here, we do have cool Pixis machines, more electronics. And this is our mom-baby room. And in here we have a mom, her name is Victoria, and she actually gives birth. We have some babies, little baby, middle-sized baby, 5-year-old child, and then we have another mom here who has just given birth. Lots of technology in this room. I'll take you this way. So this is actually the beginning of the nursing simulation lab. So each room is set up as the lights automatically come on and off. Yet another piece of technology. It's a very smart building. This is a pediatric room, set up like an ICU room. Yet another smart room. This is an adult room that we use. So there's Mr. Howell, and you'll see there's computers in the room. We'll show you one working in a minute. And then this is another room. This is actually one of our oldest mannequins, and he doesn't have a whole bunch of electronics, but we still use him a lot. And then down here we have 3 debriefing rooms, and I'll tell you about debriefing in just a minute. There's 1, 2, and here is our 3rd debriefing room. So in this room, I'm going to come walk in a little so you can kind of see what's going on. In this room, this is where the students come when they come for simulation. So they show up in this room, and the instructor actually at that point explains to them what the learning objectives are for the simulation and what their expectations are. Then they also get roles. So simulation is a bunch of role playing done by students. So they get a role, and then they go into the room and they actually do the simulation piece. So let me tell you a little bit about simulation before we jump into the room itself. So simulation is a way that students are able to come into our simulation lab with mannequins, and they do what they would do in the clinical setting with a mannequin where there can be no harm. Then after we're done with the sim, we come in this room and we do a little debriefing. And the debriefing allows us to learn about what we just did, good, bad, and different things, so that we can actually go out and take better care of students. You'll see there on the screen, we do use what we call Beeline. And that Beeline system actually helps the people that are in this room observing see what's going on in the room. So lots of technology that we use. And you'll see in just a few minutes how the instructors utilize the technology to speak to the students through the rooms and the walls. So if you want to come this way, we'll head on over and we'll see what simulation looks like from the instructor's perspective. So this is actually one of the simulation rooms. This patient's name is Susie. She's a Gamard product. She changes names based on the simulation that we're having. So sometimes she's Susie, sometimes she's Stan Checketts. We can make boys, girls, whatever happens. But you'll see she does blink. See, she is blinking. I'm sure you can hear the roar. That's actually her lungs working. So if you were to listen to her heart and her lung sounds, you'll hear them along with abdomen sounds. You also have pulses. Really cool technology in these pieces of equipment. Along with that, we also have a patient monitor in each room, and this patient monitor actually helps tells the students like what their blood pressures are, what their heart rates are, what their pulse oxes are, some other information, but those are the big pieces. And then finally, the piece of technology is a computer that we have with a bar scanner so they can actually give medications in the rooms. But this computer actually simulates a health record in the actual environment of the medical environment. So once again, it is just lets us know, this particular patient is Curtis Counts, and it tells me why he's here. So just like you'd see in an electronic record in a hospital. We call this CCBC Hospital, just kind of neat in its own little way. And then that information is here as well. So those are the pieces of the technology we use when we actually get into the room. So now that you've seen the simulation room, let's step on the control room side of things. So this is where the instructors sit, and this is where we control what's going on in the control room. Those mannequins can change. We can change all of their numbers. On this computer here, I can change all their blood pressures, all of their heart rates, anything I want to change, what kind of lung sounds I have, anything like that. I can even talk for the mannequin through this machine here. And then you'll also see this computer here is our beeline. So not only can I see through this mirror, this two-way mirror that I can see into the room and the students can't see me, I also have beeline here that I can look at and see what the students are doing. That's how we stream it into the actual debriefing room for the students to watch. So that's pretty much what we do on this side. We do have a phone that they can call the doctor with. The phone rings over on the other side, so if they need to call a doctor, we even use phone technology here in the lab.
Hi, good afternoon. My name's Stephanie. I'm going to be your student nurse today. How are you feeling?
I'm okay.
Are you having any pain?
My stomach hurts.
I'm going to do a quick assessment. Is that okay with you?
Okay, is it gonna hurt?
No, it won't hurt. Are you feeling sick?
I don't feel so well.
Are you feeling nauseous?
My stomach hurts.
Okay, I'll set your head up.
Oh, thank you.
You're welcome.
You hear my belly?
I'm listening to your... Yes, I'm listening to your belly.
Does it sound okay? Okay. Okay.
Hi, my name's Stephanie Diodato, and I played the role of the student nurse, but normally I'm nursing faculty here at CCBC.
Hi, my name is Dr. Stephanie Kratzen. I'm a nursing faculty here at CCBC Essex. I've actually been teaching here for 6 years now. You're on our control side of the simulation suite where the instructors actually control the computer here so you can hear the mannequin. So I hope you all learned something. Thank you.
So our patient Susie says thank you for watching our video. We hope to see you in the future.